Okay, so here we are with our last question thrown at Dr. David Hepburn. We've been privileged to have him here at the Victoria Cannabis Buyers Club answering some of our questions. And the final one is really kind of a big one, kind of back to the endocannabinoid system and all that jazz, because we deal with a lot of different people at different stages of life, different backgrounds, and they have different reactions to cannabis. One of the hardest things for the medical community is to deal with this, because there's so many different types of cannabis and different ways to prepare it, and then different reactions that we can have over time. But there's a lot of studies also being done on kind of genetic profiling, I guess. And so, we're curious as to whether, science is close to being able to take a DNA from someone and maybe figure out like what's, cannabinoids and terpenes may work for them.
Yeah, the whole personalized medicine, taking the genome sequencing of a person and being able to determine what the medication that works best for that person is. It's called pharmacogenomics, and typically, ideally, you would take a drop of blood, you'd run it through a biochip, a biogrid, and be able to determine from that which is the most effective medications. And they do this actually. In clinics, for example, in Toronto, every patient is a psychiatric clinic. Before they're put on an antidepressant, they're taking a blood sample and tested to see which antidepressants will work for them and which will not. There are now, of course, well-known commercial genome sequencing companies like 23andMe, perhaps the best known, and as part of the revelation they do to you is when they do the genome sequencing, is they tell you things like, will you flush with alcohol? Will cilantro taste like soap to you? All these things they have the answer for, so you can take a test and know if cilantro will taste like soap, if earwax will be wet or dry, and so forth. There's all sorts of, it's many questions that are revealed in that. So the field of pharmacogenomics is exciting. There is one company who feels that they can now predict people's response through genome sequencing. I'm not very impressed by it at all, to be honest, at this stage. I do see the future of medicine, not just cannabinoid medicine, but of medicine involving personalized medicine, where you take the personal gene sequencing and genome and you determine, A, what conditions are predisposed, B, what medications are more apt to be effective. So if you're more apt to get diabetes, then you're going to pay more attention to things that may, again, the gene loads the gun, the environment pulls the trigger. You're going to pay more attention to your environment when it comes to things you're going to, that may be more diabetogenic, things that you do that are eating and not exercising and whatnot. So again, this is, the personalized medicine world is a very new, dynamic field. When it comes to cannabis, we would love nothing better than to be able to screen and then know to match you with a particular type of cannabinoid that's going to be effective. That's not there yet, but I do see it as a very near future thing. I know it's being discussed, for sure.
Well, that's a fun way to end it, and I guess
you dropped your paper. Yeah,
thank you
must be over.
so very much.